point of this talk is to raise that as an issue. That's a problem. If it's, of course, somebody better know your marketing strategy if you're doing it. They talked about two camps. They talked about the camp of people who believe you can do data science by just exploring the data and let the data speak to you. And then there's this other camp that says you have to have a question in mind. And I'm a consultant, so do client service around data science, work for Deloitte. We have about 200 data scientists, and I lead the data science community of practice. I've worked with maybe a dozen clients or so last year. So my perspective is really shaped around business analytics, business and other organizations that have some data, and they want to improve their decision making. So I believe that not only do you have to have a question in mind as you do data science, but you need a decision in mind. And by a decision, that means being very clear about the choices the decision maker is making and who that decision maker is and the value they expect from that. So that, in a nutshell, is what I'm going to talk about. The format is really guided by case studies. You know, the advantage of doing consulting is you have battle scars from a number of both positive examples and negative examples, and hopefully they'll give us some fodder to learn from. So the examples will be taken from telecom, from public sector, and from healthcare. Three things that I've worked on. And in a bit of an advertisement for those of you who are students, especially in the MIDS program, lucky enough to be at Berkeley. If you like this sort of learning from case studies, and I'll give a little chance for audience participation. There's role play and simulation in this. I actually teach a class on this. I taught it twice at Carnegie Mellon, where I'm the adjunct faculty in the Heinz School, and I'll be teaching it at Berkeley this fall. So if you like this kind of work, feel free to sign up for that class. So let's get right down to it. The case study, the first one I'll start is my negative example. So unfortunately, if you're the kind of person who believes that all stories have to have a happy ending, you might want to shut your ears for this one. This is not one of those. The client came to us from the telecom world, and what they do is they fix things, or more formally, they provide services for a fixed fee that if your computer or your phone or your radio breaks down, they either replace it or they fix it. Think of it as the consumer equivalent as an extended warranty. But the client in this case doesn't sell direct to consumers, they actually sell to businesses. And so in relation to one of the questions that came up earlier today about business to business, this is a business to business problem. And they don't sell, the business doesn't actually sell directly to the business. What it does, it has a network of channels of distributors and resellers, and it sells contracts for the maintenance of these items through that. And the problem with this is that means that they know a little less about their customers, their end customers. The distributors hold on to that information. They don't generally share it with the original manufacturer. But on the other side of that, the original manufacturer knows more about the product and the likely failures. And so the question is, how do you get that together? So the problem here is the customers were renewing these contracts at an unacceptably low rate. And they were finding in the tradition of the terminology of the analytics world, their customers were churning too much. So we thought that we had a pretty well-defined analytics problem, which was which customers are at highest risk of churning. This is something that you may have heard that a lot of the carriers have done. So we were just applying this. And the diagram below shows kind of the process here is that they sell through channels to customers who have different contracts, and the contracts cover different items. Pretty well-defined analytics problem, so we thought. And so we got to work building one of our standard regression models, basing it on things like what are the characteristics of the customer, what are the characteristics of the item being covered, what are the characteristics of the contracts themselves, how much is the customer paying, how long is a contract for. And we built a regression model, a simple regression model. And in keeping with our tradition, we do this a lot, is we divide the customers by risk. Here it's actually propensity to renew into 10 groups by deciles. And so these are the least likely to renew, and these are the most likely to renew. And what this chart shows on the y-axis is the difference between the contracts, the propensity of actual contracts that were scored into this decile, the difference between that and the overall population in terms of propensity to renew. And you can see there's basically a rather smooth line with maybe this exception over here. So that indicates a pretty good model. The numbers here aren't terrific, but it's a decent model. So this was an okay model, and we presented it. And we said, okay, what do you think of this model? And they were like, okay, fine. And so I started asking the standard questions about, well, how do you want the results presented? What visualizations do you want? Do you care about false positives, false negatives? And the answers were weird. They were less specific than I wanted, and they came back like, sure, whatever you propose, we'll try it out and we'll see what happens. And so finally, I was a little frustrated, and I asked this question. Suppose we gave you a perfect model, one which predicted which customers were likely to leave and which ones were likely to stay with perfect accuracy, never made a mistake. What would you do with those results if it rated somebody pretty highly as likely to leave, or what would you actually do? I remember particularly there was a conference call, a dozen people on the conference call from all over the world on this, representing marketing and sales and IT and all the stakeholders we had. Dead silence. Dead silence. I asked, maybe they didn't hear me. So I said, if you had a perfect model, what would you do with it? Still a little more silence until somebody spoke up. And they said, well, we were kind of hoping that you would tell us that. Audience participation. What do you do now? You're in this situation, you or me. You're on this conference call, you can't see anybody. They're telling you, we hope you would do that. What do you say?
Hire more consultants.
Hire more people. Okay. Okay. Anybody else? Yes?
Provide an incentive to those predicted to leave.
Provide an incentive. Okay. So now you're talking about actionable about that. Okay. Making the action. Yes?
Ask them how they make these decisions today. Try and get them talking, because they don't, maybe it's just that they don't want to be the first ones to give you the wrong answer.
All good suggestions. All good. All exactly. Unfortunately, the response that I gave was something like, well, that really isn't in our scope. And we don't have the data from how effective these marketing treatments might be to retain customers, so we can't do anything, which in the circumstances, I learned from experience here, this was a perfectly accurate statement, but completely unhelpful. The right answer as a consultant, of course we can help with that, and this is how much longer it's going to take and how much more it's going to cost you. So I vowed that was a very uncomfortable moment, and I vowed that I would think about that experience some more and figure out what would help in the future. But what we had to do, that we were kind of close to the end of the engagement, and so I started talking about what has worked in the past, just like you suggested, and we came up with this idea of kind of reframing the problem to figure out, for people in certain segments, what marketing treatments would you give them? Would you give them the incentives to, say, maybe get a lower price for a longer contract renewal, increase the level of service, what have you? We listed various levers here, marketing levers, and we said for these deciles of likely to renew or unlikely to renew, these are the ones that you could give. Pure speculation. We had no idea what the marketing treatments were, how effective it was, and it kind of fell flat with this client. And the reason it fell flat, as we found out very late in the engagement, is that they had basically outsourced the entire contract renewal process to a call center, and all they could do was give the call center, here's a number to call because their contract is about to expire, why don't you call them up and try to get them to renew. They had no insight into what that call center did, what terms, how effective it was, nothing like that. And so, this is a point where I vowed to start asking this question. If you had a perfect model, what would you do with it? And do that in the future. So That's what we call framing the problem at the beginning, to try to get a better handle on what the actual problem was. So the actual problem here was that you had to figure out which customers do we have to reach out to, and what terms are we going to offer them in order to renew the contract. Okay? It's not which customers are likely to leave, because some of those might leave anyway, and you don't want to waste your time on those. You want to focus on those that you can influence their behavior, and for that you need to know something about what their behavior was in the beginning. This is the framework that we use, 4 stages for analytics projects. Framing the problem is the beginning. You're essentially converting a business question into a problem that can be informed by an analytic model. Whoops. Let's try that again. Collect the data, analyze the data, communicate and act on the results. You remember how Monica was saying that only a small percentage of the activity that you do as a data scientist is actually modeling? Well, these are some of the things that you spend the time on. Most of the people talk about collecting the data as a bulk of the time, 70 to 80%. We find that we spend a lot of time also communicating the results to a large organization and getting them to act, which often means integrating with a system, integrating with a larger organization, doing training, change management, what have you. That takes a lot of time as well. But these are some of the things that people do when they're not doing the modeling in the beginning. But in this case, we're going to focus on framing the problem. And if you want to find out the set of questions that I have for all of these, then like I talked about that course, you might want to sign up for that. But here's the decision-based approach to problem framing. We believe that business organizations, and this applies to government organizations as well, undertake analytics because they want to use their data to improve their decision-making process. Okay? So it's all use of data in service of a decision. And as I said, framing a business problem means you're trying to gather enough information about the context of the decision so that you can get information from the analytic model. The analytic model then has to be actionable in terms of the results. So what I've done with the experience that I had in refining this with the classes, so it said we can ask 3 questions. The first question is, what decision is being improved? By a decision, it's a choice between actions. So you might want to know what the actions are and what are the current information that you have to make the choice between those actions, and why you still have a decision to make. Who is deciding? Who is the decision maker? Who are the influencers on that decision? Who's a stakeholder, and so on. And then finally, what is the value of an improved decision? You can think of this as sort of a return on investment, but it's not just monetary returns. There are sometimes tangible returns and intangible returns, and you need to understand that as well. So and that leads you to a question about how much should we invest in improving this decision. So we'll go through case studies which talk about all of those, but to give you a more general sense, this is where, when you say my computer model doesn't understand my marketing strategy, you really do somehow have to get into the heads of the person making the decision. So we analyze in terms of these 5 business processes, horizontal business processes that apply to a lot of organizations. They're not all the possible uses of analytics, but the ones that we see the most often. So they're customer analytics around sales and marketing, including the customer retention, supply chain, workforce, which is an up-and-coming application for recruiting, for retention, for promotion, for evaluation, finance, how do you do pricing, how do you detect fraud, and then risk. Which of my clients is most likely to default, and sometimes it gets industry specific as well. So these are the kinds of very specific questions that you need to understand before you can actually do the analytics. So let's take an example. Child support enforcement. So as parents split up and they have child support to pay for the non-custodial parent, a lot of the non-custodial parents, sometimes in a kind of a, just reflecting the statistical reality, they're referred to as a deadbeat dad's problem. And they don't get enough child support. In fact, it's very rare to see states being able to collect more than 60% of the child support obligations which the courts order those non-custodial parents to pay. And in a slowing economy, in order to help the kids, any money that they can increase child support payments is going to help. There are a number of challenges which we won't spend a whole lot of time in here, but they relate to data not being integrated, people not being accountable for the decisions, not knowing exactly what works. And it turns out we have now done this in 5 states, including California, but one of, and this is a general approach we apply. Analytically, we take these variables, and there's some 50 or 75 variables depending on the state, ranging from how much the non-custodial parent has paid in the past, to the distance from the parent to the child, how long they've held a job, how long they've not held a job, and so on. We create a pretty simple linear formula to predict the propensity to not pay child support payments on time. And again, you go from a set of deciles from the ones who are likely to pay anyway to those who are really likely to be delinquent. And it turns out that this propensity, again, tells you how likely the parent is not to pay child support, but that's not the action. The action is, what do you do about that if you know that somebody has a certain likelihood to pay the support? And notice that we've had different colors here, and so let's go into that some more. So the ones that are really likely to become delinquent are the ones that, they're unemployed, they have no money to pay anyway, there's not much, or maybe they long-term unemployment, there's this past pattern, and there's not that much you can do about it other than just monitor what's going on. The ones at the bottom are the ones who are likely to make the payments no matter whether you do any intervention. So it's not really important. The ones you really care about are in the middle. This is the kind of the triage process that nurses go through when somebody's admitted to the emergency room or on the battlefield, what have you. They look to see if somebody is so severely injured that they're going to die. No matter what you do, you just try to make them comfortable. Those are the ones who are stable enough that they don't need immediate care. And then there are the ones in the middle who do need the immediate care, and your job is to really isolate what's in the middle there and then propose an appropriate protocol for dealing with that. And it turns out that who is deciding in this case is a case officer. There are usually a small number, unfortunately, of case officers, because the budgets are always constrained, of people who monitor all the non-custodial parents. They're assigned a fixed set, and they have to decide which of these parents they need to go after and why in order to improve the likelihood that they might pay. They get the score, they get a set of reason codes, which are given here, about why somebody has this particular score, and a set of recommended actions, which in this case is to basically review some documentation, make an entry in the diary after you call the parent, and then follow up in a couple of weeks. So that's kind of who is deciding, the second question. And the third question asks, what's the value of an improved decision, right? And the value of an improved decision in this case is not just the money. In Pennsylvania, we were able to improve the 60% collection ratio to like 80%, which was amazing. Nobody had ever been able to do that before. But it's also things like being able to be proactive rather than reactive, meaning that the enforcement officer can reach out before there's a problem. Okay? And they really appreciate this way of doing things, leading to more job satisfaction and retention of case officers, because they spend their efforts on the place where it matters. All right? And then there is value for the entire administration, like they can actually deploy this stuff and get it out pretty quickly. And as we know, with government systems, they don't always get out as quickly as might have been planned. So time to deployment, time to production is pretty important. Being able to have a view across all the regions and business processes about what is working, and being able to tell your citizens that, in fact, you know your citizens, you know the processes, and can document how well that's working. That all has value, and it's important to really, when you're talking to stakeholders and building a business case, keep track of all of this stuff, because these benefits may actually influence your choices of analytics models and eventually influence your choices of the data sources that you might use. Let me go to a third case study, the last one for this session. And this is a hospital readmissions problem, which is pretty serious in the United States. Almost 1 out of 5 patients who is admitted to a hospital is going to be readmitted within 30 days. And there are now penalties that hospitals have to pay if their readmission rate is higher than average. And the reason that there are these penalties is they think they can change the behavior because so many of these readmissions are actually preventable. There are some studies that say that 2/3 of hospital readmissions are due to people mixing medications in ways that they shouldn't have and that the hospital should have known about and could have checked for. And with a little bit of counseling and checking on people's medicine cabinets and whatever else they're taking, they might be able to prevent those readmissions. If we could save a lot of money. There's direct costs to the hospital for treating a patient that they've already treated for the same disease. There's these penalties that they would save. And of course, there would be improved patient satisfaction and all that. So it's really an important problem. So to apply our framework again, what's the decision being improved? Who is the decision maker? And then what's the value of the improved decision? So the decision being improved in this case, the way that hospitals prevent readmissions is by taking those that they think are of a high risk, usually because they've gotten a certain disease or because they've answered some questionnaire, and they admit them to a special case management program, which takes some money, but for high-risk ones, they think that this is actually worth doing it. They get some sort of counseling, some coaching, coordination of cares, different specialists see them, and so on. And the nurses use this model in a ranked list from the highest ranking readmission to the lowest probability of readmission to figure out, again, in a kind of triage process, which ones should get the care. The stakeholders listed here, we ended up talking to all of these people, but the nurses turned out to be the key decision makers. And with this one, we were actually able to improve the selectivity of the patient referral process. Before, the nurses had to look at 100 patients before they found one that was qualified to be in this program. And we improved that ratio by a factor of 50, so they only had to look at 2 patients and found one. Clearly, they were spending more time on things that mattered to them, and thus were saving lives. Now the audience participation part again. Suppose you were trying to answer the question of what is the value of an improved decision, and you were just focused on the profit to the hospital. And suppose along the x-axis here, this goes from 0 to the total number of patients in the hospital, and I can increase the number of patients who are selected for case management, and now I want to see the impact on the hospital's profit. So some facts that I'll give you is that a hospital spends something like $8,000 on one of these case management things, but if they manage to prevent a readmission, they save $16,000. So the question is, what is the shape of this graph? Is it a linear graph? So the profit is proportional, the savings is proportional to the number of cases? Who thinks that it's linear? Okay. Is it superlinear, so that the benefits actually go up the more people that they select? Somebody thinks that. Okay. Or is it sublinear? Do the benefits taper off as you select more and more? You got more people on that. So your intuitions are right for this last group. In fact, the full curve looks something like this. Not only do the benefits decrease, the marginal benefits decrease, but there's actually an optimum amount of money that you should spend on intervention. And you know why that is? Because if you intervene for too many patients, you will now be intervening for people who would never have come back to the hospital anyway, right? And it doesn't make any sense. It costs you money, some $8,000 to intervene for these patients. And so hospital administrators love this kind of analytics. They could say, not only do you have to work on a model, but you can budget. Give me a year's budget for exactly how much money I should spend on this kind of thing. And we got this, when we first did this, it took us 6 months to integrate all the data, do the analysis, draw this curve. Now we've got the process down to 2 weeks. And we take the patient mix from the different facilities and be able to tell them what the optimal number is here. These are 2 different hospitals. with a different population of different people. So in summary from those 3 cases, I know that may not be a statistically significant sample, but it seems to have worked in the time that I've done it. Businesses undertake analytic projects to improve their decision-making capability, so keeping the decision in mind is really important. These 3 questions: what decision is being improved, who is deciding, what is the value of an improved decision, turn out really good for isolating business context. And it turns out most clients actually can't answer all of these questions up front, but as consultants, we are available to help them out, and I hope that eventually some of you will be available to help them as well. Okay, that's it. Thank you. Okay. Questions?
Yeah, thanks for the talk. When you do these engagements, what exactly do you deliver? What do you turn over to the customer? You give them the analytic model. Do you also maintain it? And do you also do follow-on systems like the reporting system that gives the caseworker the score? And
yes,
what all do you
all
deliver?
of the above.
Okay.
In some cases, we just deliver a report. In some cases, we deliver the code and tell them, here, you can run the model on the data going forward. In some cases, they just want to outsource that process, and we run it for them on a kind of managed services basis. So yeah, all of those. Thanks.
In regards to, right here in the front, so the output of a lot of these predictive analytics projects are these propensity scores, or some prediction score. But a lot of times the decision being made on that last question, what is the value of an improved decision? Oftentimes that means you're making decisions in a different way. And so I'm wondering, what role do putting randomized control trials in place? Like, you're going to make a decision in a different way, so what's the impact of that? Do you consult your clients to actually run experiments of comparing the old way and the new way of making decisions? And is that part of your process flow?
Yes, actually, you remember that first example where it was really trying to figure out how to retain the customers actually than just doing that. So they didn't have any data on how to do that. And another client, we didn't get the chance on that client, but another client, we did get the chance to do that, and they consult experiments, and you can use a reinforcement learning algorithm to actually take the advantage of the feedback, and we advise them on how to do that as well. Yeah. Good question.
Okay. Back to the financial curve for the hospitals. Did you build into that, not only the per patient penalty, but also the long-term effects of negative attention from Medicare, the Department of Managed Healthcare, OSHPD, because there is a certain point where that really is going to drop because your entire business is going to fall apart. And does it pit the hospital managers against the other members of the corporation who say, well, the hospital managers want to cut pennies, and while the rest of them are more concerned with larger business and marketing issues?
Yeah, so we factor that into the model. We talked to various stakeholders who were concerned with that, the hospital chief medical officer and so on, to do that. I don't know if there's a factor in this model. One factor we also took into account was the effectiveness of an intervention. Just because you intervene doesn't mean that person automatically is not going to be readmitted. In fact, the interventions have about a 30% effectiveness rate. So there's another reason that you want to limit the number of interventions that you actually do.
So my question was, if the standard error was too large and you couldn't come up with convincing result, what do you tell your clients?
Well, that happens. Sometimes it's the data. Data quality is an issue. I mean, we've been in that very first engagement that we did, we found out that actually their contract renewal rates were consistently overstated. Because they had pulled out data, and there were some conditions that we couldn't actually do that. So then, that's a great thing about consulting. There's always another engagement. We can say, we can help you improve your data processes for doing that. So you don't necessarily solve the problem the first time out of that. especially in sophisticated analytics, when nobody has looked at the data before. So, yeah. Okay.
I think, okay, one last question.
I'm just curious, so out of, since number 3 is, what's the value of improved decision, when you're negotiating with clients,
what I'm arguing here is that you should. You don't always get that luxury to do that, but you definitely should. How are they measuring? What does success look like for you? And be as concrete as possible about what that looks like, and then work backwards from that. That's the real lesson of this talk. As concrete as possible, what success looks like, what is a successful decision, for whom exactly, who do you have to convince, and then what we found is that this really increases the odds of success for an analytics project. Okay?